So please click Got It when it appears on your screen. If you're not familiar, AARP is the nation's largest nonprofit, nonpartisan organization dedicated to empowering people to choose how they live as they age. With nearly 38 million members and offices in every state, plus Washington, D.C., Puerto Rico, and the Virgin Islands, AARP works to strengthen communities and advocates for what matters most, with a focus on health security, financial resilience, and social connection. Today's program focuses on health and wellness, which is part of our social change agenda. So, who's in the audience today? Who do you see in the chat? Joyce, if you haven't already, everyone, please put your first name and what city you're zooming in from. Joyce, who's joining us today?
Okay, I think Joyce is having technical issues, but we have Mike from Los Angeles, Karen from San Dimas, Zamora from Barstow, Perry Ann from Manhattan Beach. We have Marlena from Elmhurst, Illinois. We have Alice from St. Louis, Missouri, Peter from Azusa. Wow, people are coming in from everywhere. This is absolutely, absolutely awesome. All right. Thank you so much, Jacqueline.
That is wonderful. Thank you so much, Atisha. Thank you, everyone, for joining us today. So let's take a moment to answer our trivia question. Again, please put your answer in the chat. Today's question is, which states in the U.S. produce coffee? Hawaii, Georgia, Texas, California, or Florida? Put your answers in the chat. So, Atisha, who do you see in the chat? What answers do you see for the trivia question?
We have Hawaii. Of course, our slide popped up beforehand, but that's okay. We see a lot of Hawaii. We see Florida. We see a lot of Hawaii, tons of Hawaii. I think everybody knows Hawaii.
That's probably because of the Kona coffee. So the answer is California, Georgia, and Hawaii. Kona coffee is the United States gift to the coffee world because coffee traditionally grows best in climates along the equator. Hawaii's weather is optimal for harvesting beans. California and Georgia also recently got into the coffee game too. I really enjoy Kona coffee. I really enjoy almost any coffee. However, I did not know that California made coffee. I know you like coffee, Atisha. Do you like Kona coffee?
Yes, I do. I had the opportunity to tour actual coffee plantation in Kona, Hawaii. So it was really amazing. And I got a chance to taste the fresh coffee beans. So that actually made my day. So yes, I do love Kona coffee, but I'm curious about that Georgia coffee. And since we live in California, they need to start allowing us to actually visit where they make coffee in California. That would be great. I'm excited.
Yeah. California was a surprise to me too. So everyone, thank you very much for participating in today's trivia question. But now to get us a little warmed up, we have 3 poll questions, and I ask you to quickly submit your answers. Your answers will be anonymous. No one can see your answers. We can see your answers. We can't tell it's from you. Has a doctor or nurse referred you to or suggested you see a dentist recently? Okay, it looks like 92% say no, they have not been referred, and 8% say that they have. Our next poll question. How often do you see a dentist or hygienist in a year? Okay, it looks like 60% of us say twice a year. We have 20% that say once a year, 3 times a year for 10%. And we have 4 more at 2% and others who are still waiting to see a hygienist. Our next poll question, anonymous poll question. How many prescription and over-the-counter medications do you take regularly? Over-the-counter meaning stomach medicines or Advil or aspirin or even vitamins. Okay, it looks like 40% say that they take 1 to 3 prescriptions. 19% say they don't take anything. 12% say 4 to 5 prescriptions. And 29% say that they take more than 5 prescriptions. Thank you so much for participating in our poll. So we're delighted to have all of you join us today and hope you have your coffee or tea with you today to join us while we enjoy our program. Before we jump in, we want to share with you our disclaimer. This session is intended to be informational and educational and does not constitute medical advice, diagnosis, or treatment. You should always seek the advice of a physician or other qualified healthcare provider for a diagnosis and treatment of your specific medical needs, for questions regarding personal health or medical conditions, and before beginning or changing any treatment, activity, program, or dietary plan. AARP is not responsible for the consequences of any decisions or actions taken in reliance upon or as a result of the information provided during this event. So we're excited to present dental health for older adults. It is my pleasure to introduce our guest speaker, Dr. Elisa Chavez. Elisa M. Chavez, DDS, is a professor in the Department of Diagnostic Sciences at the Arthur A. Dugoni School of Dentistry in San Francisco. She graduated from the University of California, San Francisco School of Dentistry and earned her certificate in geriatric dentistry from the University of Michigan, Ann Arbor. Dr. Chavez has practiced in private, community health, long-term care, and hospital settings, including Centro de Salud Familia Lefe in her hometown of El Paso, Texas, the Veterans Administration in Ann Arbor, and also the Veterans Administration in Ann Arbor, Michigan, the Jewish Home for the Aged in San Francisco, and Onlook Lifeways in the Bay Area. She has served on the California Dental Association Medicare Task Force and a recent Founders Fellow and Scholar with the Santa Fe Group. She has been an advocate for the oral health needs of older adults nationwide. She is the director of the Pacific Center for Equity in Oral Health Care. Remember, please put any questions for Dr. Chavez in the chat during the program, and she will answer them during the question and answer period of our program. And per our tradition, to add some spice to the introduction, fun facts about Dr. Chavez. She has identical twin daughters, who are teenagers. That's got to be busy. The first car she ever bought herself was a truck. And as she said, I am from Texas after all. And her grandfather was actually the first person who told her, your teeth should last you your whole life, because an Army dentist had given him that information, that word of advice. Welcome, Dr. Chavez. Thank you for joining us today.
Thank you so much, Jacqueline. I'm so privileged to be here. Thank you, AARP California, for inviting me here this morning. And thanks to all of you who have taken your time this morning to be here as well. So I titled this Aging and Oral Health, What You Might Not Know, and I'm hoping there's at least one thing that you didn't know that I could tell you about today. I imagine there's a pretty diverse group of people listening with a wide range of knowledge. So hopefully I hit something here that is useful to you. And I wanted to talk about just briefly a little bit more about my current practice, just so you understand where I'm coming from. I largely care for frail older adults. So that's my point of reference. People who need quite a bit of assistance with kind of daily activities of getting dressed and getting their meals and going shopping and making appointments for dental visits and all that kind of thing. So that's largely my practice base now. And I did want to talk today about age-related versus age-prevalent oral diseases and what that means. Thinking about the scope and need for oral health care as we age, and importantly, what are the risks to our oral health over a lifetime, because they can change. So we may think we know some of the risks about oral health, but they may change as circumstances in our lives change. And how do we troubleshoot that? And then finally, we'll talk about prevention. And also just acknowledgements again, I teach and practice at University of Pacific School of Dentistry, and I have the great joy of having students with me to see patients in clinical settings. And I also consult for PACE programs, Program of All-Inclusive Care for Elders. So I may mention some products here or show them on the screen, but I don't have any financial interest in them. So just so you know that, there is examples. And then again, this is one perspective, it's a bit of information. So, it's not as thorough, it's really a broad overview. So any detailed questions you have about your own conditions, please be sure that you discuss them with your dentist and your hygienist and your physicians. So we'll have some indications for that. And then also, just because we have a broad audience, lots of different people out there, I didn't use my own clinical slides. I used general clinical slides just in case any patients or families are out there. These are not you. So just so you know that. All right, so just in case we have technical challenges, I like to start with my conclusions in case we all go off the air. That way you know where I wanted to end up today. And so one of the most important things to know is that declining oral health is not a consequence of normal aging. So just as my grandfather told me, we should expect to keep our teeth over a lifetime, and there's ways that we can help ourselves to do that. Advanced age is not a contraindication to dental care. So whether you're 80, 90, 100, oral health care is still important to receive on a regular basis. And systemic diseases can present a challenge to oral health and vice versa. So we know that oral and systemic health interact all the time, and one is important to the other. Keep in mind that dentists and hygienists are important members of your healthcare team. So often you think of your care team as being the physicians and nurses that you see, physical therapists in some cases, occupational therapists, but don't forget your dental healthcare team. And then also, share with your dentist and hygienist what's happening with you, because your needs will change over a lifetime, no matter your age. And so really letting them know about, what's going on with you, what things you like, you don't like, that can help us plan to meet your reality and make sure our plans match your expectations. All right, so I'd be remiss not to do a demographic slide, so I always try to do that. And I'm kind of using the Medicare age of 65, and we know there are 54.1 million Americans over age 65, or 16%, and that number is going to grow to 20% by 2030. And the fastest growing group is actually 85 and above. The fastest growing group expected to be 14.5 million people by 2040. And there's a small percentage of people over 65, a little bit larger percentage over 95, who live in maybe long-term care skilled nursing facilities. Also, many of you may experience this yourselves, more than half of adults over 65 and older can lack dental insurance, and we know that can present a challenge to receiving dental care. So what's in a number? It's complicated. So, whenever we have my training was in geriatrics. Well, what does that mean? So typically, I try not to think about a number per se. People are very different at 60, at 70, at 85, depending on, their life history and their health history. And so I kind of try to think about things that we might expect as people age as a normal part of aging versus things that we may see more often as people get older, such as, maybe some missing teeth, as you see the woman on the right, but that are not necessarily a normal part of aging. Thinking about age-related diseases, we know there's some changes in hearing and vision as people get older. That's part of the normal, aging process. But if we think of people having COPD, we may think of people having respiratory diseases more commonly as they get older. But again, that's a disease-related process, not a part of normal aging. And the same thing happens with the dentition. So I don't think I gave you a warning on a clinical slide. I'll try to do that. I know people have different tolerance for different kinds of slides. I try to keep them all, pretty easy. But if we think about age-related changes in oral health, we're using our teeth. So then we might expect normal wear on the teeth. Maybe we've had an accident, riding our bike and fell off and lost a tooth. These are things that happen just during the course of a life, right? Some changes in oral health that might occur. But changes that are part of, that are disease processes are different. And so we really have to differentiate the two and not expect that because we're older, we're going to be losing teeth or have gum disease. And how do we prevent that? So when I see patients, I'm really not thinking about how old they are. I'm thinking about, how healthy are they? What kinds of diseases do they have, if they have any? So we know many of us have chronic diseases that we're living with and managing, more and more. And so we have to think about that, what that means for our oral health. So when we think about age prevalent oral diseases, so those diseases we see more commonly as people get older, sometimes you think, well, cavities are for kids, right? I'm not going to have cavities when I get older. But that's not true. As long as we have teeth, we can have cavities. And older adults have a specific risk for root cavities. And part of that is because many have had also gum disease. And so the roots are exposed. They're softer than the enamel parts of the teeth that are usually present. And so that's where older people may tend to have a higher risk of getting cavities. And almost all older adults have experienced cavities at some point in their lifetime. 43% of older adults who live in poverty have untreated caries or cavities. Caries is another word for cavities, compared to 14% among people who are more affluent. So that's quite a difference. And as age increases, there's also a disparity with older people having more untreated caries. If you look in this picture, maybe just to give you a frame of reference, if you look back here, where these are some areas of root caries or root cavities, you can see this person's missing a tooth. More of the teeth are exposed, so evidence of having had gum disease or having active gum disease here. And then what you see on the teeth is what they call tartar on television, or I may refer to it as calculus. And so plaque and calculus are the most common causes of gum disease. There can be other factors in there as well, but about 10% of older population, again, we're generally using 65 as a marker, has severe gum disease. And the risk is increased among certain groups, whether they're poor, of advanced age, and certain ethnic and racial groups as well. About 17% of older adults are completely edentulous, so having no dentition remaining at all. And that has actually decreased quite a bit over the last generation. So that's good news. It used to be many more people wore complete dentures, had no teeth at all. But again, that varies among different groups. And some people with certain diseases, such as diabetes that's not well controlled, have a higher risk of tooth loss or being completely edentulous. And sometimes different states may have different rates of edentulism and untreated oral diseases. So that's kind of interesting to think about. So when we're thinking about risks of cavities, what are those risks? So there are some risks right in our mouth, and I mentioned one already. So the first is you have to have some kind of recession or loss of the bone that supports the teeth that is exposing the roots. So that's the first thing. And as that happens, the teeth get more narrow, they get a little trickier to clean. Sometimes they have little grooves in them, little depressions that are tricky to clean. And so that increases the risk. If we have a dry mouth and diminished salivary flow, that increases the risk. And of course, we're always, about brushing our teeth and flossing as we're able to, keeping our teeth as clean as possible to reduce the risk by having plaque in your mouth. If we have fillings that are maybe not in good repair anymore and they're breaking, those can create plaque traps that create risks for cavities, as well as for partial dentures, maybe that are broken in some area, trapping plaque in a place that they didn't used to. And then we think about other risks as well. So, maybe if we've had some kind of accident, we have a hard time, broke our hand, hard time using our hand to brush our teeth, that becomes a risk for cavities because we can't do as good a job as we used to. Certain diseases may impact our ability to care for ourselves, particularly individuals who may have dementia of some kind, have a hard time keeping their mouths clean. Maybe they forget. They could use some assistance reminding them to brush or how to brush. And so some people may be caring for others who have those situations. You may be taking a medication. There are many medications that diminish salivary flow. And so that's what's leading to that low salivary flow, is that medication use. Sometimes just knowledge, what are the risks to my oral health that are specific to me? Do I know what those are so that I can appropriately address them? Maybe I need a prescription fluoride now, or maybe I need to brush my teeth more often, or maybe an electric toothbrush would be helpful. Sometimes it's having the resources for the information, a dentist who's local and easy to get to, or that dental insurance, or maybe the motivation. So some people, sometimes motivation for maintaining your oral health or your general health can change over a lifetime depending what's going on. I did want to mention some efforts we make towards prevention and minimally invasive care, and these are important. So one method that we use is risk assessment, caries management by risk assessment, and that's basically what I've been talking about right now. So when you talk with your dentist, figuring out, what risks do I have for getting cavities and how can we address those? Sometimes we may need to place an interim restoration that kind of stops the cavity. Maybe we have something going on, we can't get to the filling right now. Maybe there's a health issue, maybe some other kind of issue. And so it makes sense to put in a temporary restoration to try to slow the process. And there's a material called silver diamine fluoride that we often use. It can be for tooth sensitivity, but it can also slow down, in some cases, stop cavities. So these aren't to replace regular fillings and restorations as you need them. But we all know that, there are times in our lives when sometimes it's not so easy to get everything done we need to get done. And so you can certainly ask your dentist and your hygienist about these options. All right. So one important thing we should know is that if we don't manage cavities, if we don't treat them, they do progress. And as they progress, we have other risks ahead. And one of those would be risks to the nerve of the tooth and actually getting an infection in the tooth, that then we get an infection in the bone. And one of the things that happens as a normal part of aging is the pulp tissue actually changes, and that the pulp tissue is the nerve of the tooth. So if you see in the pictures on the right and the top, you can see this dark space in here. And if you see on the bottom, it's a bit smaller. And that happens as people age. The tissue in there changes, it gets more fibrous. So people may have different response, or maybe no response, than you might have had when you were younger. So if you have a cavity that's starting and you have something sweet or you have something cold, you may get an immediate little twinge that says, oh, I'm here, there's a problem, right? But when you're older, that may not necessarily happen. Sometimes you may not notice it until the cavity is quite advanced. You have an infection in the tooth, and you might notice a little like a pimple in your gum. So that might be a sign that there's something going on that should not be there. So if you notice something like that, you want to go in and have your dentist take a look at it. So again, you may not have the same symptoms of a cavity as you did when you were younger. It may not show up until it's more advanced. And so that's why those regular checkups are really important. And sometimes your dentist may refer you to see a specialist. So as those canals get a little bit narrower, they're a little bit trickier to treat. And so they may make a referral. So important whenever we know we have cavities to get those filled as soon as we can. So we'll think about gum disease now, and we'll think about the risk factors that are right in your mouth. So if you look at this picture here, this is just a little schematic that I found, and it nicely shows, when you get inflammation of the gums and gingivitis, that's just limited to the gums. But once you have gum disease, that impacts the bone, and you start to lose the bone around the teeth. So it's kind of like when you hammer a nail in a wall, right? The more of the nail there is in the wall, the more stable it's going to be. But if you just have a little, tip of the nail in the wall, you're going to have some mobility. And so that's when teeth start to get loose. So again, we're thinking about the importance of hygiene. As people get older, the plaque does tend to form a bit faster. That may be one reason it's recommended to come in and have cleanings more often. As you lose teeth, it can be more challenging to clean around the other teeth, particularly if they start to move around. Same thing if you have fillings that are getting old and breaking down, that can create a plaque trap and create a problem. Same thing, partials that are broken or not fitting well can create plaque traps and other problems. And then decreased chewing ability also. And this is another one that may impact your risk for cavities, because now you may be choosing foods that are different. So if you find, you're missing many teeth and you're choosing foods that are softer, they may hang around the teeth a bit more and maybe require a little bit more effort to take them off of there. So your hygiene might need to step up a little bit depending on the types of foods that you're choosing. And I just wanted to show you in the x-ray here, I'm not sure you can see it, here's my mouse. On the bottom, the bone's a little bit higher on the tooth, closer to the crown of the tooth. But as you look at the picture on the top, you can see that there's much more of the root that is exposed, that the bone is, are you able to see the mouse? I'm not sure you can see my marker here. So the bone is up here, and actually it should be here. So that's how we see, evidence of bone loss on x-rays. So I just wanted to show that to you because I think it's interesting. All right, so just as with risk for cavities, we do have other risk factors for periodontal disease. So they're, they fall along the same lines. Anytime we have a condition, a situation which impacts our ability to do our own oral hygiene, to take care of that, to get to the dentist, to pay for the care that we need, all of those things can increase our risk for gum disease if we're not able to step up that preventive piece and to get treatment in early stages. So I have a break for questions here, mainly for you to put your questions in the chat box, and we'll come around to those at the end. Maybe just wanted to give you a second there to think about what we talked about. And we'll move on to,
oh, go ahead.
Okay. We'll move on to tooth loss as something we see more commonly as people get older, but again, not a normal part of aging. So we might see tooth loss when people have cavities that get so large that they can't be restored any longer, or gum disease that's so severe that the teeth need to be removed. And so how are we going to replace those? So there are many different ways that we can do that. This picture on the upper left is an image of a partial denture that's being fabricated. On the upper right, there's a fixed bridge. And then we have implants as an option. So you can discuss, all those different options. There are, pros and cons to all of them. Sometimes an option is also not to replace teeth. So depending on the situation and the number of teeth you have remaining to chew with, and your specific situation, sometimes that's an option as well. So we often don't think of that, But if your dentist suggests something like that, you have a conversation about why. So understand why they're recommending that. All right, some more clinical pictures coming. So there are also some oral pathology that we see more commonly as people get older. So there are some normal changes that occur in the oral mucosa as people get older. So as we think about the skin getting thinner and more fragile, same thing happens with the tissues in the mouth. And so people might experience some trauma from having dentures. Sometimes even if they fit well, they don't have to be ill-fitting. If you add a dry mouth onto that, it makes it much more more fragile. If you think about having dry skin, also more fragile. That can leave you prone to having fungal infections. Also increased risk of oral cancer if you've had risk factors of smoking, alcohol use, history of HPV infection. And sometimes we see drug reactions, but that's more limited. I wanted to show this picture here on the lower left. That looks pretty alarming, but actually that's excess tissue that formed from a denture that wasn't fitting well and rubbing against the mandible there for quite some time. So that's why it's important for even sometimes people think, well, if I have dentures, as long as I don't have a problem, I don't need to see anyone. Well, that might not necessarily be painful, but it can create a problem when you want to go and have a new denture made. So important to have those regular checkups. This little cracking of the corner of the lips, sometimes that's just a dry mouth, but you can also get a fungal infection in there. So, those are things that we kind of take for granted as well. That'll resolve. If it's not, you might need just a little bit of treatment there. And then we have lesions that turn up in the mouth that may be oral cancer. And so again, really important, even if you don't have teeth, you don't have dentures, still go for that oral cancer screening, because these may be in places where you wouldn't be able to see if you were looking on your own. So you want your dentist or your hygienist to be looking for those for you. So as I mentioned, dry mouth wouldn't be part of normal aging, but we do take many medications. And so dry mouth can increase your risk of having root cavities, increasing the fragility of those soft tissues we talked about that are thinning as well. If it's so severe, you may have difficulty speaking or even difficulty swallowing. You may have changes in the way that your food tastes, or you may experience some bad breath. Maybe that's your first clue that you have a dry mouth. Because interestingly, even if you have a dry mouth, you may not even feel that yourself, which is kind of unusual. You'd think that would be something you would complain about right away, but not necessarily. So we always want to identify the cause. What is the cause of the dry mouth? You might ask, well, are there medications I could take that would stimulate the salivary flow? And there are, but those are used in really specific cases for people who have very severe salivary flow, say, following a very severe dry mouth following like radiation treatment for a history of oral cancer, for example. So maybe increasing water intake, as long as that's not something you shouldn't do for some other health problem. Using sugarless candy to stimulate your salivary flow, but you want to make sure it's sugarless. Same thing with gum. And there are salivary substitutes that you can buy in the drugstore, and I have some there. Again, no preference for any of those, but those are just examples of things that you might be able to find on your own if you're experiencing that. But you do want to mention that to your dentist if you're feeling like your mouth is dry. Again, that's important for us to know, thinking about those risk factors and helping think about how we're going to prevent that. And just to be aware that there are many, many medications that can cause a dry mouth, and you might be taking them for heart disease, antidepressants and acids, people being treated for cancer, maybe on certain medications that are very drying. And there are many, many, many more. There are hundreds, literally. So it just because they can doesn't mean you'll have a dry mouth, but you might. So just want you to be aware of that. So that's one reason for the medication question that we asked about. That's one reason. All right, so again, your chance to think about what we've talked about. And if you have any questions, putting them in the chat box. All right, so The other question we asked was, how often have you seen the dentist in the last year? And typically we think, well, I'm going to go twice a year for my checkups and maybe a cleaning. And some people may need more than that. So if they have more of those risk factors, maybe, fell off the bike and had a hard time brushing their teeth or whatever the situation may be, maybe for a period of time, you need to see the dentist more often to have them help you with that preventive piece. And then as a reminder, even if you don't have any teeth, you don't have any dentures, still get in there, make sure that you're having that oral cancer screening or looking for any other kind of changes in the soft tissues of the mouth. And just keeping in mind, those change, our response to disease may change as we get older, and we may not have the symptoms that we think we do, like, that twinge when you eat something sweet or cold, or even, a toothache. You may not have that. So remember, catching things earlier just with any disease is going to be much better. And of course, what you do at home is super important. So again, your dentist, your hygienist, or your partners in that, and thinking about what's the best way for you to prevent oral diseases at home every day. It's also really important to review your health history with your dentist. So sometimes you may, they give you those forms and you're like, why do I have to answer this again? Well, really important that we know. So that we can help you better assess those risks for oral disease, thinking about if you've been newly diagnosed with diabetes, we're going to reinforce that you maintain good control as well as your doctor will, because that's going to help your periodontal situation. That will diminish your risk if you can maintain good control. If you're having difficulty with arthritis, maybe you're taking medications for pain, they're over the counter. We may want to prescribe something else to you for pain, but we need to know what you're taking on a regular basis. And you may not think of that because it's over the counter, but it's important for us to know. Some medications for osteoporosis, bisphosphonates specifically, there can be some risks if we're doing some kind of bony surgery. And so we want to be able to discuss those with you. Medications for hypertension. There are certain classes of medications that some people, the calcium channel blockers specifically, if you're taking those, some people may develop a gingival enlargement, and that can present a challenge to maintaining your good hygiene. And so, letting us know you're on those medications are important. If you've been diagnosed with cancer, what kind of treatment will you be going through? Those are all things that are important for us to know. So that's one reason I asked the question about, has a physician or nurse referred you? Because in an ideal world, what I would like is, if you were diagnosed with any of these things, for the physician to say, okay, now go see your dentist, let them know about this, tell them about this new medication you're taking, and see if there are any risks related to your oral health based on this new information. So that's why we asked for that. And then also any recent events, hospitalization for any reason, any accidents that you've had. Again, that will inform our treatment planning and our preventive plan for you. So really important to clue in your dental team about these things that have gone on, even if they seem really small. And the same thing with the medications. So if you're using nitroglycerin or inhalers, you want to take those with you to every visit. And again, as I said, some medications may have a direct impact on your oral health, potentially gingival enlargement that we talked about with the calcium channel blockers, medications that can cause dry mouth. If you're on something that may increase your bleeding, important for us to know that. If you're taking insulin for diabetes, that's informative for us too. So any new medications, including over the counter, be sure you share those with your dentist. And, another reason I don't recommend products is I really feel like you should find things that you like, because you're most likely to use them. So if you, try one thing, if your dentist recommends one thing and you don't like it, try it and say, I didn't like it, and, try to find something else. So there are lots of different products out there, lots of different ways to do things and clean teeth, and strategies we can use. So be sure to share that information with your dentist and find something you like, because then you'll use it. So just a reminder of the consequences of untreated oral diseases. And I say this because sometimes I'll have people who, we can see there's a problem. There's a cavity, but it's not uncomfortable. And so someone will say, well, I really want to wait until it hurts me. well, probably better not to, because then it becomes more complicated. We don't want anyone to get an acute infection. So when those nerves get infected in the teeth, that can be a serious infection. You know, the schematic I had there's pretty nondescript. It doesn't look very serious, but it can be very serious. So we want to avoid that when we can. Certainly it can alter your appearance if you have an acute infection, if you get swelling, or if you lose teeth as a result. And we want to minimize pain and discomfort, because once you're in pain, it's much more difficult to manage the pain to get through treatment. So we want to prevent that if we can. And any ongoing pain that's altering the way that you eat or the things that you're able to eat, you know, that should be a flag. You want to get in there and get those taken care of. Because at the end of the day, you want to eat the things you want to eat, and all that contributes to the quality of your life and enjoyment. So we want to manage things earlier on when they're not as complex to treat. And so, you know, sometimes there are barriers to that. Sometimes we don't have the information that we need. So, you know, asking your dentist, your hygienist for more information. Sometimes ageism related to ourselves, thinking, well, that's not really so important as I get older. You know, do I really need to worry about that? You know, maybe I'll just put it off and not think about it, or it's going to be expected that I lose my teeth. And I think we've already established that's not the case. So, you know, how we think about ourselves and our expectations for aging are important. Sometimes our health status is going to impact how often and where and when we're able to see the dentist. And so we have to think about that. I know lots of people are scared of the dentist, and that's something that's important to bring up with your dentist if you haven't had a good experience, why, and they can help, you know, work with you through that. And sometimes it's just habits, you know, that people are busy. And when you're busy working and running around and taking care of your kids and taking care of your grandkids and neighbors and families, you don't make time for yourselves. And so we get out of the habit of taking care of ourselves on a day-to-day basis, but also making those regular appointments for checkups. Sometimes it's, you know, the providers. We all have preferences and people that we get along with, and, you know, find a provider that you feel relates to you well. That's really important. And as we talked about, finances are a challenge. So we recognize that. And that can be a barrier. And it's also something important to discuss with your provider, you know, so that they know where your limits are in terms of your finances, because that's a reality we want to consider as well. And so you have to find the motivators for yourselves, sometimes for your family members. Hopefully the motivator is not just pain, as I mentioned, but sometimes it is. Sometimes that's what it takes to have someone come in and get care. Sometimes people don't want to be missing a tooth or without a teeth, or, you know, that sensation that you have bad breath. Why is that? You know, going in and getting those things checked out. Maybe it's aesthetics, and maybe that's your motivation. And so there are lots of dentists who can provide great aesthetic care as well. Sometimes family and friends, you know, sometimes you're going to be the motivator for your families and friends. Sometimes you'll need them to motivate you to go in. Again, because I work with largely a frail population, sometimes it's caregivers who see a problem. The patient, you know, may not even notice it, but the caregiver may, you know, ask if they see a dentist. So maybe you're a caregiver for somebody, and you would have that role of having somebody else seek care. Sometimes we get referrals from physicians and nurses, and again, it depends on your practice setting. I'm lucky to work in one where it's integrated with medical and dental. So I see a lot of physician referrals, but that's, you know, not often the case. But if you're lucky enough, you might get those referrals as well. And then thinking about your oral health in terms of your overall health, and is this a factor in good health for me, right? Viewing that as one big picture. So I'm going to leave where we started. Hopefully we've all you know, are feeling that it's not normal for our oral health to decline as we age, that we can maintain our dentition, and it doesn't matter, you know, the number that we are is not a contraindication to dental care. We know that our systemic diseases, whether they're chronic or acute, can present challenges to oral health and vice versa. And so we need to share that information with the dental team so that they can better help us plan and prevent. And so making sure that you engage them as part of the team is important because we want to meet your reality. And this is a saying I found a long time ago, and it's meant different things to me in the course of my career. And I'm not a student of the Talmud, so I apologize if anyone really is. I'm just telling you the personal meaning for me as a professional. And to me, I kind of feel like if we've done everything that we should as professionals, if we've done as much as we can as individuals, caring for ourselves, then when we reach old age, that's the time to reap the benefit of all of that, right? We're comfortable, we can enjoy our families and our friends and the foods that we like to eat, and really experience that harvest. So the other aspect from a professional perspective is I love the patients that I work with. I learn something every day in practice. So it's always fun for me. And I think it's important for you to know that about your dentist too. It's always fun for them. We're always learning right along with you. Thank you.
Oh, wow. Thank you, Dr. Chavez, for the excellent information you shared with us today. I know I've gained a lot of new insight into dental health, which is very helpful and which I needed. So we know I saw a lot of questions in the chat for Dr. Chavez. So hopefully Tisha will be able to get some of those questions. We'll get time to answer those. So let's go over to the chat. Tisha, what questions do you see for Dr. Chavez?
Thank you so much, Jacqueline. And again, thank you so much, Dr. Chavez. We are at 10 minutes, so just want to let you all know. Let's see, the one question is, what is the best source of providers of dental insurance?
Dental insurers?
Insurance, yes, or insurers, yes, ma'am.
Yeah, that's a hard question to answer. They're all pretty variable, they offer different things. So it may depend on your specific needs. Yeah, I don't know that I could answer that question in general, but I mean, I guess I would say, look into what all the different plans offer and think about what your needs are based on visits with your dentist. I mean, that may inform you as the best way to go, so that the insurance meets your needs.
Okay, then the next question says, I'm having difficulty vetting dentists for implants and dentures due to the high cost. What is a fair price to pay for implants and a lower denture? How do I find that doctor?
Okay, so that's another good question. I don't know that I can answer the fair price, for example. And again, I work in a kind of a different practice setting, so I don't, I couldn't even tell you my own fee schedule for that. But again, I think it's looking around dentists in your area to see what is usually charged for those kinds of things. Probably you'd have to have a consultation from a few different dentists to get that kind of information. You might also ask the local dental society. They may be able to provide you a range of fees in the area.
Okay. Are deep dental hygiene cleanings recommended?
They can be, yes. Those are kind of standard procedures for preventive care. So yes, I mean, they're part of treatment plans for patients quite often, so it's not an unusual recommendation.
Okay. Can you speak on the inside of the mouth lining and when you eat too much hot food or too much drink or salty chips causing a person irritation?
That's, kind of differs person to person. If you have sores in your mouth for any reason, trauma from a cheek bite or sometimes people get little blisters in their mouth, then you can be more sensitive during those times. Again, it's pretty specific person to person. Some people don't have sensitivity to any of those things, and some people might have more.
Okay. Someone is asking a question about which type of toothbrushes are the best to use. That's a tongue twister.
Well, typically I say soft toothbrush. So if we're thinking about bristle, if you're having a hard time brushing your teeth, electric toothbrushes can be very helpful because they kind of do the work for you. If you enjoy brushing your teeth, a regular toothbrush is fine if you're going to spend the time and do it well. So again, it kind of comes down to the type of toothbrush that you like, but I do always recommend a soft brush.
Okay. Are there resources for patients who have cancer or dentists who specialize in cancer patients?
Most dentists are trained to manage patients who have all different kinds of health issues. And so the most important thing is to let them know that you've been diagnosed with whatever kind of cancer it is and what your treatment plan will be. So I would say you start with a general dentist, and then if you have additional needs based on that, they can make referrals to other specialists or other dentists in their area who may treat more medically compromised patients if that's the situation. So, cancer is pretty broad, different kinds of treatment for different kinds. So I would just start with a general dentist. Most are trained to work with you and make appropriate referrals as needed.
Okay. Could you address safety concerns around COVID for the patient and the dentist or the hygienist?
So there've been lots of things implemented to keep everyone safe, and certainly all the dentists are following their local guidelines, state guidelines, federal guidelines, and they're always going to follow the ones that are the most rigorous. So we're doing that in terms of infection control in the office, screening depending on what you're coming in for, different types of procedures. Your dentist might do different kinds of screening. They'll have different air filters and those kinds of things. So it's definitely something that's been on the radar, and as revisions are needed, or organized dentistry is, and the public and county health get that information out to the dentist right away.
Okay. Someone asked the question, and I've wondered this myself, what is the difference between a deep cleaning and a regular cleaning? And how do we know when a deep cleaning is needed?
So a regular cleaning is, if you think about it, sort of at the gum, the gum level where we expect it to be. Maybe you have a little bit of inflammation. They're cleaning around the teeth, polishing. A deep cleaning is, if you think about now you have gum disease and you really need to clean those root surfaces. So that's kind of what we're thinking about. That's maybe kind of the most basic explanation I can give for that, is you're getting down to the root surfaces and you're getting into spaces that are that you wouldn't necessarily get in a regular cleaning. I didn't talk about pockets before, but your dentist may talk about pockets when they're looking at your gums. And that's basically the top of the gum to where it's attached on the tooth. And the deeper the pocket, the trickier it is to clean. So that's often where they will make a recommendation to do a deep cleaning.
And this will be our last question. However, we will be sending your questions to Dr. Chavez so she can follow up and answer them. And we would like to bring her back if she would be ever so kind to come back. But this is our last question. Is xylitol candy safe to eat twice a day?
I guess it depends on the candy itself. Usually, I think all of those things would have like a serving on it, so I would follow that. I think it would depend on the candy. So 2 sounds pretty reasonable to me. I mean, if we're thinking about sugarless candy, but again, it depends on the size of the candy and how much xylitol is in there. So I would look on the package. It probably has a serving size.
Awesome. Thank you. I'm going to turn it back over to Jacqueline.
Okay, thank you. Boy, we have a lot of good questions. And again, we'll have to, as Tisha said, try to schedule a second one because we could not get everything answered. A lot of good questions and a lot of great information.
Great.
Thank you so much again, Dr. Chavez.
Thank you for having me.
So before we close out, we'd like to take a quick pulse. Please put in the chat what one thing you will do in the upcoming week to improve your own dental health. Okay. Tisha, you want to answer a quick question or two about that in the chat?
I am looking. Get a deep cleaning. There's a lot of people that are saying great information. They're thanking Dr. Chavez, brush and floss more. This is really cool.
Okay.
A better routine and find a dentist. All right. That is
Right,
awesome.
great. Thank you so much, everyone, for participating. So help us improve our program by taking a short survey. Tell us what you liked, what you think could be improved. The link is in the chat. So our next upcoming Tea and Coffee Tuesday meeting will be Tuesday, October 11th at 9 a.m. Join us for a conversation with returning guest Mark Bowers, who will continue our conversation about what's recyclable. Mark is a solid waste management expert who will help us demystify what items are recyclable and what we can do to reduce waste and how to manage organic materials. We also invite you to join us on our quarterly series, Piggy Bank Essentials with Martin. Join us Thursday, September 29th at 9 a.m. Martin Booker, a member of AARP's Financial Resilience team, will be discussing everyday habits that can help make us financially resilient and practice money-saving choices. He will also be focusing on the money management style, Money Saver. So again, everyone, thank you so very much for participating and joining us today. Thank you to our guest, Professor and dentist, Dr. Elisa Chavez, our moderator, Atisha, our volunteer production crew, our tech specialist, Vince King and Connie Moore, our AARP staff, and of course, each and all of you. Again, I'm Jacqueline Cole, your host today. Thank you for joining us, and this concludes our program. Have a wonderful day.
Okay, I think we put everybody in the waiting room. Let me stop the recording.